Hello, everyone. Welcome to the episode 45. We are discussing SI joint pain, and this is the Physical Therapy San Pedro podcast. I am your host, Dr. Janae Brown, and I am joined by my wonderful team of physical therapists. To my left is
Dr. Bay.
And to my right,
Dr. Yana.
And like I said, we're going to be discussing SI joint pain today. Can be a controversial topic, and Dr. Yana loves the SI joint like I do. So she wrote this blog for us. Dr. Yana, tell us a little bit about why you might have chosen the SI joint, and we'll dive in after that.
Well, I chose this in specific because it's a little trickier thing we see in the clinic. People usually mention to me, well, it's not really my low back, but it's also not my hip. It's somewhere in between. So that's usually how they describe SIJ pain. And the reason I chose it is because it's actually like it's a pretty challenging impairment to treat, and it just presents it's a lot of differential diagnosis, meaning sometimes it could present as one thing, but it's actually another. So it's a good challenge, and I mainly like it because it's a lot of hip and core strengthening work as well.
Also, you have like a special Dr. Yana hip reset thing.
Yes, that too.
So she's got her own like technique based off this joint. Mm-hmm. Therefore, it's near and dear to her heart, I believe.
Yes. The good old hip reset.
I am going to be doing anatomy. I'm going to start us off. I also love the SI joint as well. And I've seen a ton of SI joint pain in my career, which has been long. So we're going to talk a little bit about it. And to join us behind us is LeBone James. He has a bony butt, this one. So we're going to utilize this bony butt to describe this structure here. The real LeBron James does not have a bony butt. So kudos to him that he doesn't have to have that problem. But the SI joint is a combination of basically the lower lumbar spine, the pelvis, and basically the tail of the lumbar spine, which we call the sacrum and the coccyx, right? So a lot of times with SI joint pain, people have a hard time identifying where it's at because it's really not the true low back. It's not like above the hips. We think about the low back being right above the hip area, but with SIJ, it's actually below the hip area, and it's actually above your hip on the side, but like above your glutes. So it's just a tricky area to kind of identify. But what it's comprised of is the sacrum. Like I said, the sacrum is an extension of the lower spine. The pelvis, which has a few parts to it. It has the ilium, the ischium, and what's the third piece? Okay, I'm blanking on it right now. But basically the sacrum and the ilium meet each other, and that forms the SI joint right in that area. Then we have some ligaments involved in the SI joint that often get irritated with SI joint pain. So we have interosseous ligaments, and we have, which are their like strong ligaments that kind of connect those bones together. And then we have ligaments that attach from like the bottom or your sit bones up to the sacrum as well. So I will say some of these ligaments for you guys so you're familiar with them, but we have the anterior sacroiliac ligament, the posterior sacroiliac ligament. Those are probably two of the most common. The posterior sacroiliac ligament is one of the most common involved in sort of a sacroiliitis or an SI joint pain. And then we have the iliolumbar ligament, which goes from the ilium to the lumbar spine. And then we have the sacrotuberous, which goes from the sacrum to the butt bone. So the middle lower spine to the butt bone. And then we have the sacrospinous ligament, which goes from the sacrum to the spine. So the ischial spine. So those are the main, basically, parts that are involved in the SI joint. And then we have just how those surfaces kind of touch each other. So we call that the articular surfaces. So the inside of the bones, that kind of how they connect to one another. The SI joint is supposed to be like the most stable joint in the body. So it's supposed to have very minimal like freedom of movement. However, we do see anatomically that the bones, just like with any other part of our body, that there will be anatomical shifts due to prolonged posturing and sort of what we do in sport, things like that. So you will see that maybe someone's, one side of their sacrum or one side of their, what's the word I'm looking for? One side of their pelvis might be like in a different position than the other side. Maybe it's more what we call inflared or exflared
Rotated.
or rotated one position or another. And so that's just due to muscle, a lot of things that we're going to talk about, muscle imbalances and things like that. So I think I covered the anatomy. And I'm sorry, we didn't talk about muscles. Muscles involved are piriformis, glute max, glute medius, erector spinae, and the multifidus muscles. So a few of the glute muscles, and we say they're involved because those muscles tend to be either weak or overstretched. So we're addressing those muscles often in SI joint pain, or they become like a secondary result of an SI joint pain. So they're kind of related, and those muscles kind of attach in the region of the pelvis and the SI joint area. And then we also have our synovial capsule, which every joint has a capsule around it. That capsule is just a space that encloses the joint and lubricates it and helps us reduce friction during movement. So, and that is right around where that sacrum and ilium meet. Yeah.
Thank you.
You're welcome. I did that on the fly. Which is why I messed up.
No.
It's supposed to be the easiest anatomy, but we have all these like big words,
That's why I didn't want it was the name of all the ligaments.
I know. I'm
I
like, wait,
would not be able to say that well.
because also we call these ligaments acronyms. Like we don't say them like
The
I
joint
said them.
itself, SIJ.
Yeah.
Yeah.
Like, we don't even want to say sacroiliac joint. We just want to say SIJ.
Yep.
Yeah. That's where it is. We're going to go into common risk factors, and Dr. Bay is going to beautifully lead us into that. She's super excited about this part.
Yeah.
She begged me for it, so I
Yeah.
gave it to her because
I
that's
didn't want those ligaments.
that's the kind of person I am. So, Dr. Bay, tell us about the things that they might deal with or have as a problem that might lead them to think, I might have SI joint pain.
Yeah, there's a pretty good list here on the blog of factors that might predispose someone to experiencing pain in the sacroiliac joint. Here they are: trauma or injury, pregnancy and childbirth, joint dysfunction, arthritis, gait abnormalities, hyper or hypomobility, occupational factors, muscle imbalance, there it is again, age, and genetics. So let's start at the top with trauma or injury. If you have a direct trauma such as a fall onto your bottom, a motor vehicle accident, another one I commonly think of is kind of like if you've had that feeling where you miss the curb or the last step and you like jolt your leg. Another common one I've seen with patients is like moving or furniture, hard pushes, pulls, and twisting. Those can all relate to sprains and strains of the sacroiliac joint. When a woman is pregnant and undergoing childbirth, there's lots of hormones fluctuating, and a key one is the hormone relaxin. The release of that hormone during pregnancy and childbirth can increase the mobility of the ligaments in the sacroiliac joint, making them more painful.
We have personal experience with that.
Yes, Dr. Brown and I, and maybe one day, Dr. Yana.
We're trying to encourage her, but
Maybe,
she
we'll
just
see.
doesn't seem ready.
Take
I don't
your
know
time.
why.
Take your time. Another predisposing factor is you might have certain inflammatory arthritic conditions in the spine. So, ankylosing spondylitis, psoriatic arthritis, osteoarthritis, all those may lead to pain and stiffness or decreased mobility. Another systemic kind of joint dysfunction is sacroiliitis. That would just be a general inflammation to the ligaments of the SIJ. And another kind of abnormal anatomy thing is sometimes people experience what is called sacralization of the lumbar spine. And that is when the last lumbar vertebrae, L5, the bone actually begins to fuse with the sacrum itself. So a lot of mobility lacks there. I've seen that for some of my patients on x-rays before. That's very interesting.
Yeah. Sounds painful.
Yeah, so that contributes to our next topic, which is hyper and hypomobility. So if hyper is big, right? Hypo is little. So excessive mobility or restricted mobility, either or can contribute to pain in the area. That kind of relaxing situation we talked about with pregnancy, that's a good example of hypermobility. Other syndromes that people are born with, for example, Ehlers-Danlos,
Oh
right?
yeah.
That's another common syndrome that is just ligament laxity throughout the body. There's different syndromes that people can experience that contribute to SI joint pain. Another common one is jobs with repetitive movements. So these occupational factors like repetitive movements, heavy lifting, being in one position for a prolonged period, those can all put constant stress on the SI joint and cause it to become inflamed. Our favorite one, the muscle imbalance topic, that's the one that we probably can make the biggest headway with here in physical therapy. If muscles are too weak or muscles are too tight, that will cause imbalance to the joint. So it will not be kind of evenly or well supported or mobile. So that will be causing different strains as you try to move. So we might be targeting different muscles here, and we'll go into that more with the treatment. Age is a factor as always. Our body experiences wear and tear as the years go on. So if you have degeneration through your cartilage, you've lost strength over the years, you've lost flexibility over the years, that can also predispose you. And the last one is genetics. Some of us, we've kind of mentioned throughout these other topics, you might be predisposed to have a certain genetic condition. A big one is ankylosing spondylitis, which is a fusion of the spine where you would become hypomobile. Inflammatory arthritic conditions you can be born with. All of those contribute to the SI joint pain and dysfunction. It's very important to understand these risk factors and communicate them with your medical professional so that they can get you to the appropriate treatment plan and use the appropriate strategies for your specific case.
Very, very well done. Is there anything you guys think on this list that is more common? Like if you're to say like it's always this, or like with SIJ, I typically always see this one particular thing. It could be these other things too, but this is always kind of true to what's going on.
Well, with a lot of the athletes and dancers I treat, the fall or a hard landing is what usually clues me in to look there first.
Yeah.
So I try to educate my patients that have gone through this. Okay, if you take another fall, try to get me to check you out right away so this doesn't have to develop into a big thing.
Yeah.
And sometimes you don't feel it right away.
Yeah.
I think the stronger the person is, the longer it takes for them to begin to feel it.
Yeah. Yeah. What about you, Dr. Anna? Is there anything on this list that you feel like is pretty like something that is consistent you consistently see?
Yes, here I've noticed a lot of muscular imbalance. So that's why, again, we mentioned my go-to hip reset. So that meaning, like usually I can tell if somebody's in the supine or laying in their back position. I look for alignment at their ankles, knees, and hips. And if it's called the supine to sit test, if there's a shift in their leg length when they're sitting up versus laying down, that usually is a big clue to me whether their pelvis is tilted posteriorly, meaning backwards, or anteriorly, meaning forwards, compared to like the neutral position. So then from there, I go into the hip reset exercises, which is basically just a series of isometrics, which are holds, holding the muscle contraction. My go-to series is like the glute bridge, adduction squeezes, abduction, and hip flexion. But if it is forward tilting, that's when you usually want to target the glutes versus like the hip flexors.
Yeah. She's already giving us a little bit of treatment. She's
Yeah,
going to talk
there's my
about that.
sauce.
Yeah. She's already going there. I tend to see very consistently like point tenderness at the SI joint. So just if I press like into this area here, this is this is the SI joint here. So if I press in the area, typically there's tenderness one side, not the other. That's another thing with SI joint pain. Typically it's one-sided. So I typically see that. I definitely see the muscle imbalances with pretty much every client. And a lot of mine are like prolonged positioning things. Like I was sitting for a long time in a certain position, or they have already poor posture towards one way or the other. Whether when I say poor posture, maybe they're inclined, not poor posture, but they're anatomically like postured either more in like a posterior pelvic tilt or more an anterior pelvic tilt. So there's like excessive stress on the SI joint one way or another. So those are my three that I would say like always is pretty like common, but I do see trauma like the misstep or the fall, and those things are kind of like those. Okay, yeah, you got this. But yeah, for me those are probably the things I typically see pretty consistent. Okay, well now you know if those are one of the things that any of those things sound like it could be me. Dr. Yana is going to tell us what we do to help you. Like, how do we actually get you better? What is physical therapy? How can it help? What will we do on our end? So Dr. Yana, give us some of that.
All right, so I'll be discussing the main interventions or the treatments you'll see us do in clinic to help with this impairment. We're going to start off by talking about different core strengthening exercises. So when it comes to SIJ pain, yes, it's important to address those little muscles that we mentioned earlier. So like the glutes, the piriformis, the multifidus, that directly attach to the sacrum or around the sacrum. But it's really important to look above and below when it comes to treating SIJ pain or pretty much anything else in the PT world, because we don't want to forget about those. So core, meaning your muscles here in the front, so your abdominals as well as the muscles in your back. So a few examples of that would be posterior pelvic tilt. So that's usually something I like to start off with to teach the patient how to actually move their pelvis anteriorly and posteriorly. But to do the posterior tilt, that's specifically rolling backwards. So I ask them to press their lower back into the floor or the mat. And that in turn also helps them feel their core engaging. So that's usually like my first go-to exercise. And then from there, we advance it. We could add straight leg raises to also work the hip flexors. Another good core strengthening exercise would be a plank or a variation of a plank. And that could be a forearm plank, high plank, side plank, or a combination of the two. And then bridging is also super beneficial. It targets the glutes as well as the core. And the glute bridge involves you starting like laying on your back and then lifting up the hips with both knees bent. So then we have pelvic stabilization exercises. So those are going to be targeting those muscles that we previously mentioned. So for example, working your hip external and internal rotators. And you'll see us doing this a lot as a mobility exercise too in the side lying position. And then we'd like to make them functional as well. So things like adding a resistance band while you're sidestepping, or like a clamshell walk and monster walks. And then something I call a hip dip, which really targets those multifidus muscles in the lower back. They're spinal stabilizers.
Which I think should be the name of a dance, the hip dip.
Yes.
So we'll have to coin your hip dip.
Or a knee drop. It could be a knee drop too.
A hip dip or a knee drop, I mean.
So what that looks like, it's basically just tabletop position. One knee is elevated like on a Eric's pad or a cushion. And then you're using those muscles in your lower back to lift that other leg so that it's even with the leg that's elevated.
Sounds good. I always love when you can teach a guy how to find his pelvis. You know, most men have no idea it's there. And you're like, do this, and then they can't. They try to bridge or lift their hips. Yeah, it's fun. We have women have a natural understanding of our pelvis because we interact with it often.
Okay,
we'll leave it there. Okay.
And then, as always, in addition to the strengthening and stabilizing exercises, it's also important to keep those areas mobile via stretching. So things you'll see us do for that would be like piriformis stretch. So that's like a figure 4, targeting that muscle that attaches from the sacrum and runs out into your hip. And then hamstring stretching too. This could be static, meaning just holding that stretch, or dynamic while moving. So you're probably familiar with how to stretch your hamstrings, but if you're not, it's the heel down, toes up, feeling the stretch all the way in the back of your leg. And then you can add like a walk with it to make it more dynamic too. And then when it comes to treating SIJ pain, we do like doing manual or hands-on techniques as well to treat this. So what that might look like is joint mobilizations. Sometimes we use the mobility belt to help with the anterior or posterior tilt of the pelvis. And then also soft tissue release or massage around those hip muscles, including piriformis, glutes, maybe a release of the hip flexors, even the muscles in the front. So like the psoas and iliacus could help with that too. And then, postural correction. That's the next big thing. So if we're working with a patient in clinic and we see there is an abnormal posture, that could definitely be contributing to pain at that joint. So that's when we want to ask them things like, what is your job require? What are you doing like on a day-to-day basis that might be aggravating this issue? And then also looking at their body mechanics when performing functional movements. So things like a squat or a lunge or like a sit to stand. And then once you're working with us for a while and it's like time to bump up your exercises, that's when we go into more functional training. When it comes to SI joint pain, like we talked about earlier, wanting to look like above and below that SI joint. This is when hamstring activation comes in, because it could very well be that the hamstrings aren't firing like they should. So something you'll see us working on is teaching our patients how to fire their hamstrings properly. And a common thing you see here is the kickstand RDL exercise. And then also dynamic stability. So that includes like balancing exercises too. Like are they able to, is that joint offering the stability it needs to when the body's in movement?
Good stuff.
And then a couple more things here. So gait training, we always analyze how somebody is walking. That'll give us big clues to if there's more, other muscular imbalances. And then, as always, modifying their activity. If they're doing something consistently that's making that pain worse, we don't tell them to stop moving altogether, but we do want to modify so it's not, they're staying within like a tolerable range. And then always setting them up for success as well with a good home exercise program.
Good stuff. With gait training, is there something that you guys see commonly with patients who have SI joint pain? What will we see like with that patient?
Usually like a hip drop. So like I can see one hip's more elevated than the other, or less weight bearing on one leg.
Mm-hmm. Yeah, I think that's a common one. Like they spend less time on that one leg, or if you do like a single limb stance, it's gonna hurt like right in that SIJ area, because it's a weight bearing joint. The hip is, that area weight bears a lot. So if you try to put your weight on it and it's painful, you're not gonna want to do it. So it's a common thing that we see with SIJ as well. Good stuff. We do a lot of good stuff, guys. We do a lot of good stuff. Look at this is amazing. We help people like this. I think we're pretty awesome. I don't know about you.
I'd agree.
Okay, so we have a few minutes. Let's talk about challenging patients. Are you guys seeing SI joint patients right now? Do you guys have anybody who's in clinic that you can think of?
Yes.
You do? Yeah.
Do we name them or?
No, don't name them. Yeah,
Shout out.
Shout out to. So let's talk about maybe a challenging case you have, and what made it challenging. What makes the SI joint challenging? You can use a patient example, but what makes it more challenging than maybe another diagnosis that we would have a patient would complain of low back pain for? So like maybe a sprain or strain or something. What makes it challenging? What could make it challenging? Thoughts?
Probably main reason being like it's that there's such limited movement there already. So it's almost like, what can I do like at this specific spot? But that's when we, target other muscles as well.
Yeah. What do you think?
Yeah, I mean, I think in that case, the population I see of a lot of people that are like jumping and standing on one leg for a long time, that we really have to get their muscles well balanced, because once something gets tired, then the joint becomes irritable again.
Yeah. Yeah. I find that sometimes too much mobility, like going after too much mobility in the beginning with the SI joint irritates it more. So I think that's the challenge with it too, is like you almost have to go after it with stability, like really heavy with stability, and then
I
like
agree.
ease in your mobility
Yeah.
because like the ligaments get stretched a lot with the mobility stuff. So
Or even determining is it hyper or hypomobile.
true. Yeah, for sure. Yeah, it can be tricky that way. Also, just people that tend to have like the postural like need the postural correction will often go into the same postures that are irritable. Like, so it's like it's a lot of education like behind it. Like, okay, if you sit and it bothers you to sit for like more than a few minutes, then stop sitting, get up, move, because it will kind of like go away with SI joint pain. I've noticed that it'll kind of go away, but when they go to stand up again, that's a big one, the sit to stand, right? It'll get irritated with that transition because from the prolonged, they'll stay in that position. They don't really notice it anymore, but then they go to transition and it's like a sharp pain because that area is annoyed with that transition. So yeah, it can be hard. And I think there's a lot of like controversy. We talked about this in the beginning about like the amount of movement and like, can you do a hip reset? Can you correct the, do a muscle energy technique to correct, the rotation. And I think it's misconstrued for that reason. We're using those techniques to stabilize and create more balance in the body where we see imbalances. But like we know that whatever position the pelvis is in, typically when it comes to us, we probably won't change too much out of that, but we're trying to help give relief by working on those limitations, the things that are weaker or overstretched or irritated. Yeah. So if you have SI joint pain, there is help out there. Don't think that there's not, because we can do a lot of things about it. And we love helping our patients get through it.
Definitely.
So, yeah. You love the hip, you love the SIJ. I love it. So we kind of fight over this one, I think. No, I'm just kidding. So we like it. So if you have SI joint pain, you know where to go. Okay, well, I think that wraps up sort of this beautiful diagnosis that we love treating. If you are tuning in to us for the first time, we have 44 more episodes on YouTube for your watching enjoyment, especially if you enjoyed this episode. We have 44 more episodes on any podcast that you might listen to. So Apple, Spotify, Amazon Music, if you'd like to listen. We would love to educate you and teach you about all the things that we know and love here at Physical Therapy San Pedro. If you're dealing with some low back pain, specifically you have SI joint pain, we'd love to help you there too. You can visit our website. You can go on our Instagram, Facebook at Physical Therapy San Pedro, and you can get information about setting up an appointment with one of us. And we would love to help you. We do telehealth across the country, so you don't actually have to come into the clinic. You can actually do it with us virtually. We do that with a lot of patients, and we give them great success that way. So that's another option. And lastly, if you are trying to do things from home and you're looking for resources for online programming, we have just released our first program in the series that we're putting out for the ankle. So it's called the Ankle Pain Program. That's online. So if you're having ankle pain, go check that out. You can take yourself through our sauce at home. We don't have to actually be here or even on a computer with us. You can just do it from your own home, from your own computer on your own. So I think that's it. That's all I have. Do you guys have anything else that I might have missed or you want to share? Or
That was good.
That was good. We're done then. Okay, guys, until next time. Bye.
Bye.